Congratulations on your pregnancy and the expectant arrival of your new family member. At SoSure Health, the staff, midwives, physicians, and volunteers are committed to providing a quality birthing experience. We would like your stay with us to be as welcoming and comfortable as possible. Please take a few minutes to watch this video, as it explains many of the experiences you may have during your stay with us. SoSure Regional Hospital in Bridgewater is the birthing center for the SoSure. You will see this site in this video. Before you come to the hospital, you will need to have some supplies ready to bring along with you. As with any overnight stay, you will need clothes, pajamas, your personal items such as a toothbrush, deodorant, shampoo, and razors. If you have a support person, they will need all these items as well. Remember, there will be another little person joining you during your stay, so you will need to bring clothes for the baby as well. Some people also prefer to bring their own sanitary pads, diapers, and breast pads. Also, some people prefer to bring their own pillow and comfortable clothes for when they are in labor. If you are choosing to formula feed your baby, it is recommended that you bring ready-to-feed liquid formula of your preferred brand. Powdered formula for infants under 2 months of age is not recommended. A complete list of suggested items can be found in the book, A New Life, or can be discussed with your OBS clinic or midwifery visit. If you think you are in labor, we suggest you call the Maternal Child Unit at SoSure Regional, often referred to as the MAT Child or OBS Unit, at 527-5214, or your midwife, depending on who is providing your prenatal care. When you think you might be in labor, come to the SoSure Regional Hospital, located at 90 Glen Ellen Drive in Bridgewater. Your support person can drop you off in the drop-off zone at the front entrance, assist you into the hospital, then proceed to park the vehicle. It is a good idea to have a small supply of loonies and toonies in your car to cover the parking fees at the hospital. There are weekly and monthly parking passes available too. For more information, you can contact the business office at SoSure Regional. Once you enter the hospital, please go directly to the front desk. It is open 24 hours a day, 7 days a week. Remember to bring your provincial health card with you for registration. It is recommended that at your 34-week OBS clinic or midwife visit or another scheduled appointment around this time, you complete the pre-admission paperwork. This will make your admission process faster. Take the elevators to the 4th floor, where the OBS unit is located. There is a team of health professionals who may provide care on the OBS unit. This includes midwives, doctors, and nurses. All members of the team work together to provide you with the specialized care you and your baby require. After you check in at the nurse's station at the OBS unit, a nurse or midwife will take you to a private room for a physical exam and to listen to your baby's heartbeat, which will help determine whether you are in early or active labor. If you have been laboring at home with the support of a midwife prior to coming to the hospital, she will have already determined whether you are in early or active labor. 3 things can happen next. If you are in early labor and live close to the hospital, you may be sent home. If that happens, your nurse will give you guidelines on when you should return. If you are in early labor but have traveled some distance to get to the hospital, your nurse can help you with other plans. If you are in active labor, you will be admitted to your room.
So this will be your room.
The rooms at this hospital have either one bed or two beds. You will be placed in a room according to private insurance, availability, and needs of yourself or other patients. Your room will also have a television, telephone, and washroom. Bath and shower are available on the unit for your use. There may be a small fee associated with activating the telephone and television. Please refer to the patient handbook for more details. The birthing room is where you will spend your active labor and deliver your baby. All the equipment that may be used during your labor and your baby's birth is in this room. Equipment such as a birthing ball, squatting bar, mirror, and rocking chair are available for you to use. If you would like to play music during your labor, please bring along your own device. If you have a birth plan, your nurse or midwife will go over it with you and your support person. A birth plan is a guide to share with your healthcare team how you wish to labor and deliver. You will have open conversations with your nurse or midwife the entire time. Remember, a birth plan is just a guide, and you can change your mind at any point. Once you are in active labor, you will receive one-to-one supportive care throughout your labor and delivery. All of our OBS nurses and midwives are educated in supportive care in labor. While you are in active labor, water, juice, and popsicles are available. Your support person is responsible for his or her own drinks and food. There is a cafeteria, coffee and vending machines in the hospital. You are also welcome to bring your own snacks. SoSure Health encourages mothers to make decisions on methods for coping with labor. You can walk, change positions, use the birthing ball, or the bathtub. Many people choose to use the soothing comforts of water during labor. You can labor in the tub, but at the time of birth, you will need to move to the birthing room. We do not have the proper equipment to support water births at this time. Some people choose not to use anything or to use natural methods to help them cope with labor. Others may choose medications. Nitrous oxide, laughing gas, narcotics such as morphine or fentanyl, or epidurals are all available. Speak to your healthcare provider about what might work best for you and what is available at the stage of your labor. Walking epidurals are not available at SoSure Health. If you choose to have the help of a doula during your labor, they are welcome to support you in the OBS unit and in the birthing room. However, space is limited, so it is suggested to only bring 2 support people. You should expect that there will be a nurse for you, one for the baby, as well as your doctor and/or midwife present at the time of birth. The healthcare team will increase if you need a cesarean section, also known as a C-section. SoSure Health supports students in the health professions. You may be asked if a student can follow you throughout your time on the OBS unit. This will be your decision. Some families wish to have their older children with them during the birth. This should be discussed with your midwife or doctor. Children under the age of 12 would need an additional person to supervise them during your labor and birth. Various medical interventions may be necessary as the safest option for you and your baby. It may not be appropriate for children to be present during certain procedures. If a C-section becomes the method of birth for your baby, your nurse, midwife, or your doctor will introduce you to the obstetrician, sometimes referred to as an OB/GYN, who will be taking over your care. Your doctor or midwife will continue to care for your baby. Depending on the type of care you will need, it may be possible to have one support person accompany you in the operating room. After your baby is born, you will have the opportunity to bond with your baby by having them lie with you skin to skin. It is a time to get to know your baby. This is also an opportunity for you and your baby to start learning about breastfeeding. The first mother's milk is the best thing you can provide your baby. Before you leave the birthing room, your baby will be weighed, examined from head to toe, have an ankle identification band put on, and receive vitamin K and eye ointment applied with your consent. When you and your baby are ready, you will be moved to your room. In the first few hours after birth, you will be encouraged to feed your baby. SoSure Health promotes, protects, and supports breastfeeding according to Health Canada's recommendation of exclusive breastfeeding for the first 6 months of a baby's life, with continued breastfeeding for up to 2 years and beyond. Research has shown this is the best option for your baby. However, SoSure Health will support and respect the decision each mother makes about how to feed her baby and to help her in the information she needs to properly nourish her baby. There are no restrictions of visiting hours on the OBS unit, but we encourage visitors to be respectful of your needs and the needs of other families on the unit. Your partner, support person, baby siblings, and grandparents are welcome to visit any time. However, having a baby can be exhausting, so it is sometimes a good idea to ask your friends to wait and visit after you get home. In most cases, your support person can stay with you in your room. The OBS unit does have a number of cots for this purpose. However, there is not a cot for every room. If you would like a cot, please request one when you arrive on the unit. The person staying with you is there to help you with your baby and to be part of the learning experience. Your support person is responsible for his or her personal items and meals. Pajamas are required for you and your support person. Your meals at SoSure Regional are provided through our Dial for Dining. During your stay at the hospital, you may choose what you would like to eat from the menu by calling Dial for Dining. To learn more about Dial for Dining and how to place an order, please refer to your patient handbook. You are also welcome to bring some of your own food if this is your preference. There is a fridge on the unit to place labeled personal food items. Your baby will stay with you in your room. Members of your healthcare team will have other patient responsibilities, but will be checking on you and your baby during your stay. If you are having challenges with feeding your baby, there are various healthcare providers who can assist you. Talk with them about your concerns. The nurses on the OBS unit and midwives are trained to provide this support or make referrals as necessary. There are dietitians, lactation consultants, and other community resources that are available to support you. To learn more, check out the resources listed at the end of this video. Your time in the OBS unit will give you a chance to learn many things about caring for yourself and your new baby. As you get to know your baby, you will learn his or her language and cues. If you have not already been provided a copy of the Loving Care series, you will be given a copy on the unit. These books provide lots of information about caring for your baby and yourself. While you are in the hospital, you will also be given papers to register your baby's birth, apply for a health card, and birth certificate. There is an Access Nova Scotia kiosk available at the hospital to complete this process electronically. The nurses and midwives are available to help answer your questions about your new baby during your time on the OBS unit. The usual stay for someone who has had a vaginal birth is 2 to 3 days, 3 days after a C-section. If a midwife is you and your baby's primary care provider, you have the option of going home at 4 to 6 hours after birth if you both are well and you prefer to go home. The midwife will come see you once a day in the first few days after the birth, whether you are at home or in the hospital. With your consent, your baby will have a hearing test and routine blood tests while on the unit. To keep your baby calm during blood tests and procedures, the nursing and laboratory staff strongly encourages you or your partner to have skin-to-skin contact or that you will breastfeed your baby. If your child is born with special care needs, your choices around early contact will depend on the medical needs of your child. The healthcare team will ensure you are included in decisions about your child's care. If you had a C-section, you will still be able to have early contact with your baby, including skin-to-skin and breastfeeding, depending on your healthcare needs. You will continue to be able to care for the needs of your baby. During your surgical recovery, though, you will have some physical restrictions that will be discussed with your doctor or midwife. If your child has special care needs, they may be transported to the IWK. If this is the situation, you may wish to watch the virtual tour produced by the IWK regarding the Neonatal Intensive Care Unit, also referred to as the NICU. When you are medically ready to be discharged, your midwife or doctor and the nurses will discuss this with you. They will review any questions or follow-up that may be required. Your baby will receive a free bag of baby books from the Read to Me program. Books are a great way to get to know your baby and will give them an early start on developing language and communication skills. It is the law in Nova Scotia that all babies being transported in a vehicle must be properly secured in a federally approved car seat. Call Child Safety Link at 470-7036 or 1-866-288-1388 if you have any questions about car seats. You'll want to buy your car seat before the baby is born, as you must have it installed prior to leaving the hospital if the baby is to be transported home by car. There are also a number of local car seat technicians that can help you properly install your car seat. Contact the OBS Clinic, your midwife, Family Resource Center, RCMP, or Public Health to get the names of trained technicians in your area. Many families trade or buy second-hand car seats. Parents should be aware of the expiry date and history of the car seat. It is not recommended to use a car seat you do not know the history of or that may have been in an accident. Prior to leaving the hospital, someone from the unit will check the baby's positioning in the car seat. When leaving the hospital, you will be responsible for taking your baby and all your belongings with you, and don't forget your pillow from home. If you require a wheelchair, this will be available for you. We have many resources in our community that are designed for children and parents. Contact your local Family Resource Center to learn about baby groups in your area. These are a great opportunity to meet other expectant and new parents, to learn from each other on the adventure into parenthood. Family Resource Centers can support you in learning more about these programs, or you can visit your local library, recreation department, or peer breastfeeding support groups, such as the La Lèche League. Thank you for taking the time to watch this video. We hope you have found it helpful in answering some of your questions. If you have further questions, please discuss these at your OBS clinic or midwifery appointment.